Hello everyone, today we are going to learn an important topic in pharmacology, drugs used in the treatment of Parkinson's disease. Before studying the drugs, first we must understand what Parkinson's disease actually is. If students understand the disease clearly, then remembering the drugs become very easy. Parkinson's disease is a progressive neurodegenerative disorder mainly affecting the body movements. Neuro means nerves, degenerative means gradual damage. So, in this disease, certain brain cells slowly get damaged over time. The main problem occurs in a part of the brain called the substantia nigra. This area normally produces an important neurotransmitter called dopamine. Dopamine helps in smooth muscle movements, coordination, balance, controlling voluntary movements. When dopamine levels decreases, movement becomes abnormal. There are four classical symptoms. Tremor. The patient's hands shake continuously, especially during rest. Example, you may notice elderly patients with hand shaking while sitting quietly. Second, rigidity. Muscles become stiff. The patient feels difficulty while moving hands and legs. Third, bradykinesia. Brady means slow, kinesia means movement. So the patient performs movements very slowly. Even simple tasks like buttoning shirt, walking, eating, they all become difficult. Next, postural instability. The loss of balance occurs. The patient may fall easily. Normally in the brain, there should be a balance between dopamine and acetylcholine. In Parkinson's disease, the dopamine decreases and acetylcholine activity becomes relatively more. This imbalance causes movement problems. So, treatment mainly aims to increase dopamine or reduce cholinergic activity. Next, the goals of treatment. The treatment goals are improve movement, reduce tremor, improve quality of life, help patient perform daily activities. Important point is these drugs control symptoms but usually do not completely cure the disease. Next, classification of anti-Parkinson's disease. The drugs are divided into several groups: levodopa plus carbidopa, dopamine agonist, MAOB inhibitors, COMT inhibitors, anticholinergic drugs, amantadine. So, there are two different types of anti-Parkinson's disease: drugs acting brain dopamine system and drugs affecting brain cholinergic system. So, dopamine precursor, levodopa, dopaminergic agonist, bromocriptine, propinerol, pramipexole. COMT inhibitors, entacapone, tolcapone. Peripheral decarboxylase inhibitors, carbidopa, benzoyl. MAOB inhibitors, selegiline and rasagiline. Glutamate agonist, amantadine. Next, direct affecting brain cholinergic system. They are further classified into central anticholinergics and antihistaminics. Anticholinergics are trihexyphenidyl, procyclidine, biperidine. Antihistaminics are phenadrine, promethazine. So, levodopa is the gold standard drug for Parkinson's disease. It is the most effective drug. This is an important question. Why not give dopamine directly? If we give dopamine directly, it cannot cross the blood-brain barrier, so it cannot enter the brain effectively. But levodopa can cross the blood-brain barrier. Inside the brain, the levodopa converts into dopamine, so dopamine level increases. Inside the brain, the levodopa converted into dopamine. This increases dopamine concentration and improves movements. And it improves bradykinesia, rigidity, tremors. Especially bradykinesia improves very well. Some levodopa gets converted into dopamine outside the brain. So some levodopa gets converted into dopamine outside the brain also. This causes side effects like nausea, vomiting, palpitation. So we combine levodopa with another drug called carbidopa. Carbidopa inhibits peripheral conversion of levodopa into dopamine. Carbidopa does not enter the brain, it acts only outside the brain. So, more levodopa reaches the brain, side effect reduces. This is why combination therapy is preferred. For example, levodopa plus carbidopa combination tablets. Next, the adverse effect of levodopa and carbidopa. Abnormally involuntary movements occur. The patient may show jerky movements, facial twitching, uncontrolled movements, nausea and vomiting. Blood pressure drops while standing, hallucination, especially in elderly patients. And in this Parkinson drugs have two phenomena: wearing off phenomenon and on off phenomenon. Initially, levodopa works very well, but after long term use, its duration becomes shorter. The patient experiences symptom return before next dose. This is called wearing off effect. Sometimes suddenly drugs works properly, and then suddenly symptoms return. This fluctuation is called on-off phenomenon. Next, dopamine agonists. These drugs directly stimulate dopamine receptors, for example, pramipexole, ropinirole, bromocriptine. Instead of converting into dopamine, these drugs directly activate dopamine receptors. So the movement is improves. And the advantages of dopamine agonists are delay levodopa use, reduce motor fluctuation, usually in early disease. And adverse effects are hallucination, sleep attacks, hypotension, confusion. So some patients suddenly fall asleep while sitting or driving. So caution is very important. Next, MAOB inhibitors. For example, selegiline and rosagiline. Normally, dopamine gets breakdown by an enzyme called MAOB. These drugs inhibit MAOB enzyme, so dopamine destruction decreases. So the result is more dopamine remains in brain. The advantages are increased dopamine levels, improved symptoms. It can be combined with levodopa. The side effects are insomnia, headache, and confusion. Next, COMT inhibitors. For example, entacapone and tolcapone. The COMT enzymes breaks down levodopa. COMT inhibitors prevent this breakdown, so levodopa duration increases. It is used for wearing off phenomenon. And the side effects are tolcapone may cause hepatotoxicity. So liver monitoring is very important. Next, anticholinergic drugs. For example, examples are benztropine trihexyphenidyl. So why anticholinergics are used in Parkinson's disease? It decreases the dopamine and acetylcholine activity becomes relatively high. These drugs reduces acetylcholine activity, so balance is improved. And the effects are tremor, rigidity, not very effective for bradykinesia. The side effects are dry mouth, constipation, blood vision, urinary retention. Elderly patients may develop confusions. Next, amantadine. Amantadine originally developed as an antiviral drug. Later, it was found useful in Parkinson's disease, and it also increases dopamine release and decreases dopamine reuptake. So, dopamine availability increases, and it is used for mild Parkinson's diseases and levodopa-induced dyskinesia. The side effects are ankle edema, confusion, and insomnia. Next, the important clinical points are doctors may initially use dopamine agonist. In severe elderly patients, levodopa is commonly preferred because it is most effective. And drugs alone are not enough. The patients also need physiotherapy, exercise, balanced diet, emotional support, exercise, and so the exercise improves mobility and balance. So the Parkinson's disease occurs mainly due to dopamine deficiency in the brain. The treatment mainly focuses on increasing dopamine activity or reducing cholinergic activity. So among all drugs, the levodopa